Hey everyone, this is the Family Docs Podcast, and I'm your host, Dr. Rob Assibey, and we have an episode for you today with a very, very special guest. We're talking about vaccines with Dr. Alex McDonald. Before we get started, I wanted to welcome my very good friend, Dr. Cynthia Chen-Joea, who is now joining us in the Family Docs Podcast as our co-host. Welcome, Cynthia.
Hi, Rob. I'm so excited to be jumping officially on board and start hosting with everyone's favorite family physician, as you say, and excited to chat today with Dr. Alex McDonald about vaccines.
Well, let's get to it.
Welcome to the Family Docs Podcast.
Dr. McDonald, welcome back to the Family Docs Podcast. Most of our listeners are likely to know you, but just in case they don't, I want to give you a very brief introduction. Now, mind you, this doesn't include all of the wonderful things that Dr. McDonald does. So, Alex McDonald, MD, FAAFP, CAQSM, is a former professional athlete, family and sports medicine physician, and newly associate program director of the Kaiser Permanente Fontana Family Medicine Residency Program. Dr. McDonald is an AFP and CAFP media spokesperson and social media ambassador with a passion for family physicians to raise their voice for their patients. Dr. McDonald regularly writes for the Physicians Weekly and contributes to the Physicians Weekly podcast. Just recently, writing an article titled Vaccine Misinformation, Pseudoscience, and the Frailty of Community Health. Dr. McDonald is a recipient of the 2025 AFP Vaccine Science Fellowship and recently was awarded the California Immunization Coalition's 2025 Ronald P. Bangasser Immunization Leadership Award. Welcome, Dr. McDonald.
Thank you so much for having me. I appreciate to be back, and I'm excited for your new co-host.
You and me both. And as an AFP Vaccine Science Fellow and a longtime vaccine advocate, what are some of the most important things family physicians should know right now about vaccines?
Where do I begin? There's a lot going on right now. I think the first thing that we all are acutely aware of is that vaccines and immunizations are becoming deeply politicized in the United States. And there is a ton of misinformation and disinformation swirling around vaccines. There are questions. There are people who have questions about vaccines, which makes perfect sense, and that's legitimate. But there's also a small and a very well funded and a very vocal group of individuals and organizations which are really promoting and spreading vaccine misinformation. And as a result, that is sowing distrust and misunderstanding and making our jobs as family physicians much, much harder, which I think everyone out there who practices medicine has seen this. It was trickling a little bit before the COVID-19 pandemic, and since then has exploded, quite frankly. Furthermore, there's a lot going on right now in the world of politics and health policy, especially in DC. As many people know, the Advisory Committee on Immunization Practices has been around for decades and is a group of highly qualified, educated experts in the vaccine space, pharmacists, physicians, epidemiologists, public health researchers. There's a very good variety, plus many advisors to that committee as well from many large medical organizations across the country. Now, recently, HHS Secretary has basically fired all 17 members of that Advisory Committee on Immunization Practices and replaced them with his own picks, essentially. Now, the ACIP was not a perfect process. There were some challenges. There were some issues, no question. But this feels a bit like throwing the baby out with the bathwater. And furthermore, instead of evidence-based vaccine policy, it is vaccine policy evidence making. And if you understand the difference there, they're basically starting with ideology and what they want to do, and then cherry picking or creating really poor quality evidence to support those claims. And so this is a very, very dangerous precedent which they're setting. But this is the playbook of people who have been opposed to vaccines for the last 20 or 30 years. It's unfortunately now just becoming, they've reached a point where they are in positions of power to really implement these changes within the system that we have developed for a transparent, open, collaborative, evidence-based practice to create vaccines. So that's kind of where we are in this point. I want to remind our listeners, and I think many of them know this, is that immunizations are still the greatest medical advancement of the 21st century. They've saved millions of lives around the world. They've prevented millions more from morbidity and suffering. And immunizations are currently underappreciated by the public because they have been so successful. No one remembers polio, or many people don't remember polio because we've likely eradicated it. Many people, although unfortunately this is changing, don't remember measles because we had likely eradicated it, well, until recently, but that's another issue. So I think vaccines are a victim of their own success. And so the public memory is very short, unfortunately. I'm constantly preaching that the importance of staying up to date on vaccines and consistent with vaccine recommendations is really in the best interest of our patients and the public. And furthermore, I just want to remind everyone out there, although I imagine most of our listeners know, that vaccines are exceptionally well studied and exceptionally safe. And there is a very long and rigorous process before any vaccine comes to market. And it's really based on science and evidence. And lastly, a lot is in flux right now, as I mentioned at the beginning of this long spiel. I apologize, I'm talking too long. There's a lot in flux right now, but I can guarantee you that the AAFP is working very hard to ensure patients can still obtain access to immunizations, that immunizations are continued to be covered by insurance, and that recommendations are based on good science and good high quality evidence. And so I really want to encourage and remind all of our listeners out there and our physicians out there, especially, that continue to follow the guidelines, continue to follow recommendations. That may change in the future, unfortunately, but as of right now, we have good guidelines, we have good recommendations, and we need to continue to follow those.
Thank you so much for that, Alex, and really highlighting the fact that historically vaccine recommendations are really based on evidence-based science and medicine.
Correct.
And I'm so curious, what trends, so as a vaccine fellow, what trends are you seeing in vaccination rates post-pandemic? And are you seeing that we're maybe making progress or facing new challenges now at this point?
Thanks for that question. It's a really good question. Unfortunately, routine childhood vaccinations still remain below pre-pandemic levels, with a notable decline in children, especially. So, for example, children born in 2020 had a 10% lower coverage for routine immunization series by age 2 compared to those who were born in 2016. And as of late 2022, at least, coverage really hasn't picked up. It hasn't caught up to those pre-pandemic rates. And so that's an important thing. There's definitely disparities by race and ethnicity, particularly among Black children, have lower vaccination rates. And some areas of lower socioeconomic status have lower vaccination rates. And these gaps have persisted and in some cases even widened, which is a huge issue when it comes to health equity, ensuring our most vulnerable patients are protected and healthy. When it comes to just adult vaccine uptake in general, I think you can think about sort of COVID-19 vaccine particularly. Initially uptake was really pretty good during the peak of the pandemic, but then boosters and updated vaccine uptake has certainly struggled and stagnated at very low levels, with only about 20% of eligible adults receiving their bivalent boosters as of early 2023. So it's a little bit out of date, but I don't think those numbers have changed significantly. And this is obviously caused by a lot of vaccine hesitancy, a lot of concerns, side effects, lack of perceived health benefits, and a lot of logistic barriers. Unfortunately, the rate of vaccines in this country is not in a very good place. And quite frankly, family physicians and the medical industry in general has not found a narrative and is really losing sort of the public information effort to help educate our patients regarding the importance of vaccines. Despite measles outbreaks and things like that, it has raised a little bit more awareness, but really not to the point where we need to be to really make sure we maintain herd immunity and maximize our patients' health.
Yeah, thank you for that, Alex. And to kind of try to I guess, decrease some of this vaccine hesitancy that we've seen since the pandemic. Are there any like common myths that you feel like you want to debunk or you feel like you wish more people understood?
There are so many. Where do I begin here? Well, honestly, I mean, if I could pick just one thing regarding sort of a myth for family physicians in particular, is it's really about the psychology of understanding why people are hesitant and why people don't get vaccinated. So there's a ton of myths out there, right? But I think if we as family physicians really understood kind of the psychology behind it, that might be more valuable. So that's what I'm going to share here, if that's okay. I'm going to tweak your question. So really, it's regarding something called loss aversion fallacy or loss aversion bias. And so this is a cognitive bias where there is a perceived pain of losing something is psychologically or emotionally more impactful than the pleasure of gaining something of equal or even greater value. This is a concept that in behavior economics and marketing and why we all go and buy a million things constantly off Amazon. So this is really a key piece driving a lot of people's healthcare and vaccine choices. And so let me kind of give this as an example within vaccines. So really, people tend to focus on the potential side effects. Individuals will focus on, the although minor and rare, vaccine side effects. Perceiving this as a tangible loss of health or well-being, rather than recognizing that the significant gains associated with immunization and vaccinations are far greater when it comes to preventing illness, disease, or death. But that's sort of a theoretical versus the perceived side effects are kind of a right here and now. There's really an overemphasis a lot on this negative information. And that last loss aversion can really make individuals more sensitive to some of those, potential downsides or side effects of the vaccine. Even though they're very rare and few severe adverse side effects, it's really kind of overplayed, and that potential downside of vaccination is really overplayed. Furthermore, really valuing people tend to value this sort of quote natural immunity or wild type immunity, which is gained through actually contracting the disease, and potentially underestimating a lot of the potential side effects and risk associated with the illness itself. And so, the CDC had this great campaign: go from wild to mild, right? So you could get the wild type, the vaccine, wild type infection, which creates immunity, no question, but you have all the potential risks of actually getting the disease and all those side effects, versus mild side effects with significant lower risk of severe complications. And so that loss, it feels like sort of a state which confuses some people. And then lastly, the reluctance to change the status quo. So loss aversion can contribute to sort of that status quo bias. People would prefer just to maintain the existing situation rather than do something new, such as vaccinations, which potentially could have side effects, even though there's clear evidence which suggests, the benefits of doing something new and getting vaccinated far outweigh the potential side effects. So again, this loss aversion is really what's perceived out there, and is really the reason a lot of people make these decisions, which are really not in their best interest a lot of times, kind of irrationally focusing on or overestimating the magnitude of potential side effects or potential negative outcomes, while really minimizing or neglecting the potential benefits or the gains. And so, not really a myth regarding vaccines, but it's kind of the undertone and underpinning of why a lot of these myths sort of take off. And so that's the thing I wish family doctors thought about and knew more about when it comes to vaccine information.
Thank you for that. That was fascinating. And thank you for including a little bit about the psychology behind why we see these vaccination trends over the decades. And so I have been dying to ask you this question since the beginning. You founded hashtag This Is Our Shot. And can you just tell us a little bit more about the movement and why and how it started?
Yeah, well, honestly, we saw a need and we tried to fill it. So early 2020, probably late 2020, right when we were kind of at the peak of the pandemic, vaccines had not been released yet, but were sort of were talking about it. We knew it was going to be relatively soon. A colleague of mine from the California Medical Association, we're sort of on the phone together, and we're like, this is ridiculous. We need to do something. We need to spread the word. We had this unique moment in time where we as healthcare workers and physicians actually had the opportunity to lead by example. We were some of the first people in line to be able to get vaccinated. I remember this. I will remember this day probably to the day I die. It was December 17th at about 10:30 in the morning. I was rounding in the ICU on a bunch of COVID patients. And I got a text page saying, COVID-19 vaccines are available for physicians. Come to the third floor cafeteria, wherever. And I was dropped everything and I went there and I got my vaccine. I took a picture. I did a selfie, obviously, because hashtag social media. And I took this private act of immunization and I turned it into sort of a public act, so to speak, to help show people. I actually had one of my nurses stop by every day to see if I had grown a third eyeball or anything weird was happening in the coming days afterwards. And I really realized we could lead by example here. So we collected individuals and created sort of this Zoom meetings where we could get together and provide support for each other, but also realized that we needed to help really lead by example. There's a Kaiser family study which came out right before that saying, who would you trust when it comes to vaccine information? It had Congress, pharmacy, the president, all these things, right? And the number one thing was your physician, not a physician, your physician. And family physicians as trusted advisors who've really built continuous, comprehensive, longitudinal relationships with our patients. We've built that trust, and we were the best source of information and the place where people turn to the most when it comes to information. And so basically we tried to take that and operationalize that and really help show people that we got vaccinated ourselves, but also help support healthcare workers and pharmacists and nurses and physical therapists and doctors and any member of the healthcare team. We tried to create webinars and information sources for them to feel empowered to have these conversations with their patients. It's very hard when you make a recommendation and the patient's like, nope. And most people are just like, oh, okay, that's fine. Right. But how do we engage? How do we lean in? And that was really the goal behind This Is Our Shot and our Spanish version, Vaccination, to really help empower physicians and use our trusted messengers to help support each other so that then we could educate patients. It was amazing. We're connected with people all over the country. And it was one of those things where there was a moment in time and we sort of rose to the occasion, I think, and created something that I hope will last, because it's still needed today, unfortunately.
No, thank you for that. Actually, as you're talking about it, Alex, I remember getting my shot. It was January 4th, 2021, around
Yep.
9:30. And it was such a monumental time for all of us, right? Especially during the heart of the pandemic. And I think you brought up a good point when you just talked about it right now, which leads to my next question. About when you're recommending these vaccines, I think it was very important during that time to let our patients and families know that we also were getting the vaccines and why we felt it was so important. And you didn't grow that third eye yet during that time, right? I mean, who knows? Maybe it went away.
Time will
But
tell.
but I think to your point, it is hard for family physicians to have those vaccine conversations with families and to get them to vaccinate themselves. And to your point about the children and how the vaccine rates have still not gotten back to where they were pre-pandemic. So our listeners want to know, do you have a specific script or any specific advice to lead these conversations to kind of either decrease the hesitancy or try to find ways to get them to improving the vaccination rates?
Absolutely. It really comes down to communication. And I think as physicians, we are really not well trained when it comes to communication and messaging. When somebody doesn't want to get their vaccine, immediately start throwing out facts and figures and datas and studies and whatnot, and that does not work. Right? People don't care about the facts and figures and studies. They care about empathy. They care about understanding where they're coming from and addressing their own fears or concerns, regardless of kind of how potentially out of left field they may be. Really actually throwing out those facts and figures doesn't really do anything other than alienate our patients, quite frankly. And so there's several different models. One that I learned from Dr. Todd Wolin, who's a pediatrician from Pennsylvania, is called the Ames model. And it's a quick, easy mnemonic to remember, but there are a lot of kind of evidence-based communication tools out there. But I'll kind of go through the Ames model, and they all have the same kind of idea. So A, announce; I, inquire; M, mirror; and S, secure. So, all right, announce. Mary is due for HPV vaccine, her flu vaccine, and her Tdap vaccine today. I recommend you get those vaccines, right? And if mom, dad says yes, great, you're done, right? You don't ask them; you announce that they're due for these things. If they say, well, I heard that HPV vaccine can actually cause young girls to become sterile, and I don't want her having sex anyway until she's an adult or even married, and I always get sick from the flu vaccine, so I don't want to do that. So then you mirror. Oh, you know what? I absolutely understand your concerns. I don't want Mary to have side effects or become sterile either. Certainly, sex is a private act and something for much later, obviously. But really, here's some information. Here are my thoughts. Can I share you my thoughts and my experience? And that little piece of asking to give your recommendation changes the dynamic from one that's sort of adversarial and confrontational to one that's much more collaborative. I have yet to have a patient say, no, I don't want to hear your thoughts, right? They're there in your office. They will almost 99% of the time say, oh, okay, sure. And I kind of go into my spiel about, HPV actually shows to be, if you get your HPV vaccine early, you can actually prevent cervical cancer, genital warts, penile cancer, you name it, later in life, even if they're not sexually active for years to come. In fact, it's more effective the earlier you get it before you're sexually active. I tell them, it's impossible to get sick from the flu shot. This is kind of my thoughts. I always tell people that I got my COVID vaccine. I got my flu vaccine. I physically gave it to my children myself. Right? That's how much I believe in it. And personalizing that story really helps quite a bit. So that's kind of my personal approach as I take it. But really, the key here is to listen to where their concerns are, to mirror them, to provide empathy, to validate their concerns. Don't validate the conspiracy theories. Validate that they're concerned about their child, because we really want to do what's best for the patient in front of us. And we think that's getting vaccinated. They don't necessarily think that's getting vaccinated. And how do we close that gap, but focus on what's best for the child? And then lastly, S, secure. You don't secure the vaccine, you secure the relationship, because that is the most important thing. I want to make what's the best decision for little Mary here, and I really want to make sure that you're making good decisions for her. But I want you to make those decisions based on good, accurate information. And there's a lot of junk information out there. So please, if you have questions, if you have concerns, come ask me. Sometimes I'll sort of use humor when a patient doesn't want to get their flu vaccine, despite my conversations. I'm like, you know what? That's okay. It's your choice, obviously. But if you get sick, you can't come say complaining to me, or I'm going to say I told you so. So sometimes using some humor and personalizing it can make a big difference. And lastly, just because they don't want to get their vaccine today, securing the relationship, they're going to come back to you. They're going to see you again for something else, and you have the opportunity to then talk about and make those vaccine recommendations again. So that is, evidence-based communication. There's no single approach. Everyone has to sort of find their own nuances to that conversation. And then lastly, I don't have this conversation every single day with every single patient. Within the first 2 seconds of bringing up the idea of vaccination, I can tell from a patient's face if it's a conversation worth having, if this is someone who is open to information, to learning more, or someone who's already made up their mind. And if it's somebody who's already made up their mind, I still make the recommendation. I still announce they're due for it. But then I will secure the relationship and move on, because we have such limited time, and time is the most challenging, the most limited resource we have in our lives in this day and age. And so you can spend 5 minutes doing this, you can spend 1 minute doing this. It really doesn't take a lot of time, but if we do it every single time, every single visit, it really adds up over time.
Wow, Alex, what a great framework for being able to build a collaborative relationship with our patient aims. And I think you touched on something. You said securing the relationship, which I think what you alluded to is probably the most important point in that framework. it kind of leads me to my next question, which is what role do you think we as family physicians can play in rebuilding that trust in the public health? When you talk about securing that relationship, it's one patient at a time. But when we're talking about the public health as a whole, it's a whole different entity. So I'm curious to know your thoughts on that.
Yeah, this is something I struggle with quite a bit, and it's when you start thinking about a big picture, it's just overwhelming. And so again, I always think about the fact that now more than ever, the trust that we have built as family physicians between our patients is really critical, and we need to sort of lean into that. This is what we do every single day, and so really trying to do the right thing for our patients. So we provide, as I said, comprehensive, continuous, longitudinal care. And in doing so, we've built these incredibly important and trusting relationships with our patients. And I think that's the key. We really need to educate our patients one at a time, right? In the exam room, you have to get your whole staff on board. You have to get your nursing, your front desk, your check-in, your pharmacist, everyone kind of on the same page. I think that's really key. So we can lead by example within our healthcare team, just locally in our clinic. And so that feels a little bit easier. That feels a little bit more attainable. But then we can also think about what are ways that we can expand our reach beyond the four walls of the hospital, the four walls of the clinic. How can we reach out into the community? Can we do health fairs? Can we visit schools? Can we use both traditional and non-traditional media to share our thoughts and ideas? Because even though that doctor on TV or that doctor on your social media feed may not convince you to get the vaccine, it's one more piece in the puzzle to put out there to counter the misinformation and the disinformation that may be swirling out there around vaccines. So I like using the Finding Nemo analogy. Cynthia, I know you have a young daughter. I have young kids. Oh, Rob, you have young kids too. For those of you who have young kids, you've probably seen the movie Finding Nemo. And there's that scene where there's all the school of fish caught in a net, right? And they're all swimming in every direction. They're freaking out. And Nemo, like the littlest, tiniest one amongst them, says, "Everybody swim down. Everyone swim in this direction." So all the fish start swimming in one direction. They almost like tip over the fishing boat. They break the net open and they all swim free. And I think that's what we really need to do. If we all do one little tiny piece of the puzzle, if we all help do our part and swim in the right direction, we can really make an impact. Because again, physicians and your physicians are the most trusted members when it comes to our healthcare choices. And I think we need to lean into that.
Great Finding Nemo analogy. My son's school actually did a play on it last month, and he's been obsessed with Finding Nemo, where he's running around the house pretending to be Nemo.
Perfect.
But it is quite amazing. Everything you've been saying really fits into advocacy, right? You're basically talking about advocacy. And I know you've been very involved in advocacy. And I feel like my advocacy journey started a lot with your help and mentorship from many, many years ago. So, like, how did you first get involved? Like, I know you do so much, and our listeners also might want to get involved, but sometimes it's like, how do you get that first start? So we're interested to see that this wonderful advocacy world of Alex McDonald, where did it all begin? And I know we may not have time for all of it, but just give us a brief tidbits of where it kind of started and how you got to where you are.
Sure. So I think when we think about advocacy, we have like the little a advocacy, and there's the big A advocacy. So we do this every single day. We advocate for our patients. We do prior authorizations to advocate for our patients getting their medications. And so we do this every single day. We just don't know about it, or we don't necessarily put it in that framework. So you can advocate for your patients on an individual level every single day, which we all do anyway. We can advocate for changes or policies or procedures within our clinics, within our hospital systems. So we do this work every single day. Now, then you can think about sort of the big A advocacy, which everyone thinks of as like, going to Capitol Hill and testifying before Congress. And that's just so far out there that just feels unattainable. So the way that I got involved was actually honestly a little bit by accident. In undergraduate, I did a certificate program called Program in Community Action, which really focused on policy in the community level. I did my thesis on caring the psychological needs of caring for children with HIV or whose parents had HIV in the Boston area. So that's kind of where I started thinking about policy and advocacy. Then I got into medical school and poof, it was gone from my brain. I didn't do anything about advocacy again until I was actually a third year resident. I was on an email group from the California Academy of Family Physicians with resident and student issues. And there was a resident who could not go to the AAFP National Conference to serve as one of the delegates for the resident Congress there. So I responded to the email and I was like, oh, sure, I'll go. And I was the first one to respond. So I got to go to Kansas City. And I was absolutely blown away by the passion, by the energy. I had found my people. I'd found my family medicine tribe. And I on a whim, ran for the resident delegate to the big AAFP Congress of Delegates. I was selected by my peers, and then I got to go to the big Congress of Delegates and realized that this world of advocacy and policy is grown by each of us, but it's also just about showing up. You don't have to know everything. You have to just be there and share your voice and share your experience, because that's really what matters. And so I'll go into that later, but I think really just showing up to a meeting is the key piece here. And that's kind of how I got involved in advocacy.
I loved hearing that story. It reminds me of my first NCCL, where on a whim, I also tried to run for
Mhm.
co-convener, and you sat down next to me and shared with me that you did the same and also didn't win your first time.
Yep.
And so I think that really reemphasized the fact of what you just said, because it helped. All of it was good experience, just showing up. And when I went the second year, I was able to get co-convener. And I think you had a very similar story. So what advice would you want to give to physicians who maybe want to get involved in advocacy and everything that you're doing, all these conferences and running for positions, and maybe don't know where to start?
So, as I said, just showing up. 80% of life is just showing up. You can show up and you can learn and you can share your stories and you can share your patient stories, which are so incredibly powerful. And that requires no prior training whatsoever. Furthermore, you can meet and connect with amazing mentors and colleagues and people who then become your friends. So I think that's really the biggest thing here. Whatever, there are all these different awareness month. There's breast cancer month and there's colon cancer month, and August actually happens to be National Immunization Month. And so whatever kind of the focus is at that moment in time, like lead into that, kind of connect with some of those resources. You can do it through social media, you can do it through websites, you can do it through conferences. So that's really an important piece. For those of you in California specifically, or maybe even on the West Coast, I highly, highly encourage you to come to our California Academy's Family Physician meeting, our POP meeting, as we call it, or Prism of Practice, which is an amazing event for medical students and residents with individual workshops and connection sessions, but also a tremendous amount of wonderful, wonderful CME. So any of you out there listening to this, definitely make sure you Google CAFP POP and sign up and register. It's a phenomenal meeting, and I have met so many amazing and incredible friends and mentors within CAFP and AFP that have really altered the trajectory of my career in ways that I never thought possible. And so that's kind of one thing right there. You can sign up to be an AAFP Key Contacts. Just Google AFP Key Contacts, where you can get information about ongoing meetings. You can attend webinars about information which is occurring. You can be an advocacy ambassador within the AFP or the CAFP. The all-member advocacy meeting is every spring in Sacramento, which is another great kind of really health advocacy focused meeting where you learn a little bit about advocacy, and then we go and meet with legislators the following day to really practice those skills. Run for or apply for a CAFP commission or committee or an AAFP commission or committee. Those are great ways to put yourself out there and put your name out there. Again, even if you don't get selected the first time around or elected the first time around, do it again. Just keep showing up and being whatever issue you're passionate about. I tell people just be politely persistent. That's the key, right? Just continue to show up. And if it doesn't happen the first time, that's okay. Change, unfortunately, is incremental. And that's really the key. So showing up and being politely persistent, those are my two biggest takeaways.
Amazing. Absolutely amazing. Thank you for all of that, Alex. I think you touched on so many great points today in the vaccine world, in the immunization world, in the advocacy world. Um, Fortunately for me, I also had a similar start with AFP and CAP and advocacy, but at NCCL, I won co-convener my first time. So sorry, guys. Maybe some of us are just built different.
That's okay.
Uh,
Just everyone's to their own.
but I do agree that showing up is very, very important. And regardless of where you are in your journey, just showing up can kind of help propel you to places where you never thought you could go. So once again, Alex, I don't even know there's enough words to thank you for everything you've done for all of us and even in the family medicine community. And thank you for taking the time out of everything that you do to be able to come and speak to our listeners about something obviously very true and dear to your heart and very, very important for us as family physicians. So we definitely appreciate that. We hope our listeners were able to gain some level of information and knowledge because we learn something new every day. I even learned new things today too that I think I will continue to use within my own personal practice. So, big thanks to you, Alex. Big thanks to Cynthia as well for being a co-host today. She's also very, very amazing. And you guys have heard her multiple times already. We'll continue to see more of the work that she does. So Cynthia, we appreciate you for everything.
Thank you so much, Alex, for joining us today. And I'll definitely be thinking about you tonight when my daughter is advocating for her Finding Nemo, because that has been her latest craze.
Amazing. Well, thank you so much for having me. I really appreciate this. I hope some of your listeners got some information out of this, and just keep showing up. That's what we do for our patients and for community. And I really appreciate the time today.
Alex is amazing. I know that's not part of the recording, but
he is amazing. It should be part of the recording.
We encourage you to join the conversation by sharing your thoughts and experiences with us by tagging CAFP on social media or email us at podcast@familydocs.org. Your feedback is vital as we continue to explore and address the challenges facing the medical community. If you have any questions about any of the resources or want any more information, please look at the show notes below. Don't forget to subscribe, rate, and share the Family Docs podcast. Come back for more discussions on pivotal topics in the medical field. Thank you for tuning in. And until next time, this is your favorite family physician.
And your other favorite family physician,
Dr. Rob Assibey.
And Dr. Cynthia Chen-Joea. This podcast was created, produced, and recorded by the California Academy of Family Physicians. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent or the California Academy of Family Physicians. Welcome to the Family Docs podcast.
And you guys need to do that again.
How do we do that? I was just thinking about that. How are we gonna cue 1, 2, 3? Welcome to the Family Docs podcast, or
yeah, let's
welcome to the Family Doc. How are we gonna?
Oh, welcome to the Family Docs podcast.
That way, I like that way better. If you want my opinion.